Hi, my name is Ivy Stearns, and I decided to do my project over strep throat. What is strep throat? Strep throat is a bacterial infection that is in the back of the throat, causing the tonsils to be inflamed with white patches. And a person that is infected with it they have a horrible pain. It's very common in the children from ages 5 to 15. But anyone at any age could catch on to this. It's typically called Streptococcus vaginis or Group A Streptococcus. How can I get strep throat? So you can get strep throat by being in the same area as a person, the air, blood, or saliva. It's typically after you've been around them, you touch your eyes, your nose, or your mouth. If you're around someone, they can either cough or sneeze on you, and you can get that. If you share a food or a drink with them, or even their toothbrush, you can get that. Touching something like, say, like they touched this computer, and then I went ahead and touched that, and then I put my hands in my mouth, my eyes, or my nose, and I could potentially get that, as well as doorknobs, faucets, blankets, or even the same clothes. Some symptoms, they experience the sore throat, and then you would see the white patches in the back of the throat. You have very trouble swallowing, and then comes a fever, typically of 101 degrees and over. Headaches, chills, loss of appetite is the most common one. The lymph nodes are very swollen. The symptoms typically occur within the first 5 days of being sick, so they're very onset. Treatments. So antibiotics are a huge one to get rid of strep throat. Most people don't believe in medicine, but antibiotics is typically the only way to get rid of strep throat. They stop the infection, spread of infection to others. Some of the three main antibiotics that are used is penicillin, amoxicillin, and cephalexin. And if you're allergic to any of the above, you can use azithromycin. Like I'm allergic to penicillin, so I can't take that. Doctors would then also prescribe you acetaminophen or ibuprofen to help lower the fever and help with the pain that the people are experiencing. When you take the antibiotics, you're typically, after 24 hours, you're no longer contagious. If you do not take the antibiotics, the person will be then contagious for probably up to 2 to 3 weeks, and then after the symptoms are gone, then you're no longer contagious. The medicine also helps by decreasing the spread to others and decreasing the risk of spreading to other parts of your body. Obviously, if strep throat does continue for more than a month after the treatment and it's just not working, they would then highly recommend surgery of tonsils taking out. I also, in my research, found a lot of at-home remedies that worked. Obviously, washing your hands and taking acetaminophen or ibuprofen to reduce the inflammation of the throat. Washing hands, killing the germs, and washing everything, killing the germs so no longer spread anywhere. Drinking warm liquids like lemon water or tea helps soothe the throat, also as well cold liquids, lemon water, or just ice cold water helps numb the throat. When you go to bed at night, having a humidifier in the room so you can have better breathing. Throat drops and throat spray are typically the ones that people go to once they have a sore throat. The throat spray will numb the throat and help people swallow easier. When my sister had strep throat, we made her gargle a little bit of warm salt water at night before she went to bed. I also found that warm apple cider vinegar helps. It's gross, but it also helps. Essential oils, so if you wanted add essential oils into the humidifier before you went to bed at night. They'll help you breathe. Even just inhaling them, taking a whiff of all the essential oils to help you breathe and help with the headache and soothe the throat. When you're sick, you just want to kind of take a bath. So soaking in this essential oils also helps. Some lavender helps with the headache. Thyme, lemon, they usually help with like just being able to breathe and relax. Eucalyptus, it helps with relaxing. Peppermint, garlic, and just like that mint and ginger, they also help with like exfoliating and clearing out the sinuses, being able to breathe. The main worry of getting strep throat is how can I prevent it? So you kind of just want to avoid anyone that you know is either potentially going to get strep throat or is sick, period. Make sure that if you are around them, if you can't avoid them, you just want to clean and sanitize everything that they touch or are around. Wash your hands often, obviously, and try not to use the same glass, eating utensils, or even a toothbrush that the person has been infected. Instead of using handkerchiefs, use tissues so you can dispose the tissues instead of reusing the handkerchief and making the infection spread. If you are infected, avoid sneezing and coughing on others, and obviously the daily vitamins help a lot. So most people don't treat because some people don't believe in medicine. So if strep throat is untreated, it can lead to an ear infection. Sinus infection, it could get worse. Most strep throat, obviously you have a sinus infection already. You can get a rheumatic fever, which is an inflammatory disease to the joints, skin, and the heart. The kidneys will then become inflamed. You can get scarlet fever, and the throat already has white patches in the back, but you would then experience abscesses in the back of the throat, which then the doctor would need to go in and pop them and let them drain. And then if they keep coming back, surgery for them the tonsils would need to come out. And these are my sources.